So why are you guys here?
Oh, have we begun? Marvelous.
I don't know. I've hit record on all the things.
Okay, so we're recording. Marvelous.
Yes.
Well, tell us the title of your show.
It's called EEG World.
EEG World. Marvelous.
EEG World, yes.
And it will be weekly?
Yeah, we're going to have weekly conversations with real people and perhaps even more frequent demos and clips and explorations from my end, just alone on my computer.
That's good.
Yeah.
So we're here at the ISNR conference in Dallas, Texas.
Yes.
It's been fascinating. It's day one.
Day one.
Day one of the official conference.
Yes, and I've heard you speak more than I've heard you speak over the past many months.
Oh, really?
Well, no, that's not true, actually. Mike just got done with a literal marathon of speaking and blowing people's minds. Tell us what you were talking about today.
Oh, we had a three-hour discussion talking about the metabolism and toxins in the brain and brain waves. And I think we threw in some MTBI as well, some brain injury as well. So that was the topic.
And how the hell does that have to do with EEG?
Well, sometimes the EEG doesn't look so good after treatment or before treatment, and you don't know why. So we thought maybe we should check for toxins. Maybe we should look for deficiencies. Maybe we should look for excesses of something, imbalances of metabolism, and then see if the EEG gets better with or without treatment. And sometimes even the EEG is bad because they're full of mold. And so you do an EEG and you think, man, that looks horrible. Maybe we should have, screened for mold first or something.
So you're saying neurofeedback doesn't work?
Oh, no, God, no. God, no. I wouldn't say that. I would say sometimes if you were doing a treatment or even an assessment and it looked particularly bad, it may not be just their brain. It may be some other factor layered on top of it. Yes. And we better look at that.
So we're having a wardrobe malfunction here.
Uh-oh.
I think I disconnected.
No, you're fine.
Accidentally, but I think now it's working.
And Natasha, tell me, what are you doing here?
Well, hi again.
Hello.
Well, I'm here kind of, to learn, to network. This is my fourth day. I came initially to neuro field workshop, the 3-day workshop, Nick Doggers and by Tiff Thompson. So it was interesting. They introduced some updates as far as their hardware and software. It was an interesting group of people, like a nice mix, different professionals, from nurses to counselors, psychologists, some doctors, and so forth. And I think when we have a variety of attendees, we get a lot of different questions and we learn from each other. So I think it's the benefit of, one of the benefits of attending the conference and then meeting people in person as well, and exchanging professional experiences. So far it's been really good. And of course, I attended Mike's presentation. It was excellent.
Give us the review. What's the tomato meter out of 100%?
The Rotten Tomato meter?
Well, I think, for counselors, nurses, just increasing the awareness and kind of like broadening perspective on mental health field and understanding how important triage is and not to get stuck, and only think, that everything is in your hands and that that's all you can do for your client. You use a certain set of tools. So I think that, people walked out with an open mind. We learned a lot about toxicity, some biochemistry, and I think, it's really important that we take into consideration the whole body and for psychologists and neurofeedback practitioners to kind of like, look at from a holistic perspective and understand clients' patterns, what they're eating, how they're sleeping. And that's certainly going to have a big role in how they present, and it's going to have a huge impact on our treatment as well.
Have you seen a difference in the metabolic component of mental health in your practice?
Yeah, certainly. Yeah. Changes in diet, increase energy. Patients subjectively feel better. It has an impact on QEG. They start reducing their medications. Their energy goes up. Sleep patterns improve. So these are all significant elements, as far as the client's progress and how they present during the treatment and have a significant impact on their well-being, and are a great addition to what we do in terms of talk and cognitive performance and training and neuromodulation and stimulation. So
Did you find that they were able to just take a few supplements and get better, or did they have to change their diet too and take supplements?
they certainly couldn't get better just by taking a couple of supplements. So
Well, some people can, so I had to ask, because
yeah, well, my population, is a little bit different. I work usually with a little bit more complex cases. So I see more progress when they start changing their diets, like, reducing carbohydrates, increasing protein, and then, of course, supplementing, vitamin B, omega 3s, like just the essentials. And then also improving their quality of sleep. I think, yeah, it's important to have a good sleep hygiene and introducing like light exercise. So when all that comes together after, I would say 10 to 15 sessions, you start to see some improvement. That's in my population that I'm working with, but maybe in people that have less, problems. And when you're working with high peak performance, it might be different. But for my clinical practice, that's kind of like a window of 10 to 15 sessions. So it's like over 2 months, I would say.
well, that's good. Have you got anybody that did any cleanses or anything to clean out stuff of any kind?
Not yet. No.
And you did some lab tests for these people? Lab tests of some kind of metabolism or toxin testing?
Yeah, some basic labs, like we did some toxin testing. We did the Dutch,
Hormone testing?
yeah,
Okay, good.
hormonal testing. And yeah, when you're mentioning, now that you're mentioning hormonal testing, I always check in, with their hormonal status. I ask them, if they have hormonal issues. I think it's really important to address because hormones do have such a high impact on how our brain works. And, we look into that. And I started consulting with Michael recently and also attending the grand rounds. And I feel like I've been learning
Oh,
a lot.
metabolic grand rounds. Thank
Yeah,
you.
yeah,
Thank you.
metabolic
Yeah.
grand
Yeah, I'm glad to hear it.
These two know each other. Yeah, I mean, I'm speechless because to me it feels like the population that comes to neurofeedback, the person that comes to us, neurofeedback, neuromodulation, EEG assessment, are people who generally have struck out with other forms of mental health options or feel like they've plateaued somehow. And so, yeah, I guess not speechless, but just that there's this whole world of sort of functional medicine and kind of assessment of the broader organism on various chemical levels. It has me sort of rethinking my own priorities, like the way I look at what I think of as like just people's brainwaves, like whatever the map is, it's like how much of that is, just what's going on in the brain, and how much of that is what's going on in the rest of the body. And obviously, it's like you can't separate those two things. And especially the more I learn about the blood-brain barrier, the more I realize that like modern life has predisposed us to be especially vulnerable, or just, there's this porous interface between our world, the water we're drinking,
Everything.
like everything, and like what's making its way into the brain. So yeah, speechless in that we just got a big download on this guy about all, not just the details of the different tests that you were starting to talk about, but also just the broader kind of detective work kind of thinking that goes into questioning what tests might be valuable and questioning sort of like what's kind of root cause or what processes may be underlying people's symptoms from like a toxic and also like a nutrient, like micronutrient kind of perspective. It's just like, it's this Pandora's box where it's like once you start opening it, you realize how connected these things are to each other.
Yeah, it really is like a sleuth thing. Was there anything, I'm dying to know, was there any piece that jumped out at you that was more like profound than others? Or,
No, it was all just very superficial. Well, it's funny. I mean,
it doesn't
so
have to be one thing. I mean, you already said.
so I've been helping Mike with his study group. So I've heard all this stuff plenty of times, helping Mike with his study group. So, but yeah, you know, it's cool it's interesting. It's after having spent so much time online working with people who are interested and excited about this, to then seeing you work with more novices, right? Like people who haven't, maybe, you know, different levels in terms of like going down this functional medicine rabbit hole. And yeah, as far as like what jumped out at me, it's like you have this incredibly detailed level that you can go on things, and also you have the ability to bring it back to the macro. Um, and I think like it's hard to it's challenging to enter into the conversation with some people because it does challenge our it just challenge our concepts of the way like medicine works, or like I think people can appreciate that like a lot of their medical experiences are very kind of siloed and like they're working with someone who has blinders on, but it's also it's like a little bit surprising how limited that like vision can be, you know? So like cryptopyrroles as an example, that's like a super specific thing that has to do with a particular metabolic process. And if you don't know how to look for it, like you're probably not going to see it. And I had never heard of it until I had like read Afrin's book.
Yep.
Right. And yet it seems like that has like a role in like a bunch of different, you know, mental health disorders, but also like weird physical symptoms. You want to talk more about that?
Gosh, well, cryptopyrroluria specifically is a hemoglobin disorder, so it has to do with malformation of the heme molecule. So it can affect vasculature, it can affect organs, it can affect your brain differently, and it can affect it can make you hallucinate. You can feel like you're talking to God when you're not. Maybe some people do talk to God, but these people are not really talking to God. They think they are. So they're having experiences that are really scary for them sometimes. I remember having a number of children in my practice that were teenage children, you know, boys and girls that were talking about having voices in their heads and seeing things that were not real. Some of them were very spiritual and church-based families, and they were really profoundly affected by it in that way, and others were not, and they were also profoundly affected, but all of them were scared to death because they weren't really sure if it was real, it was profound, it was deep, and their parents were really questioning because they were saying, man, this is really wild, and we want to support our child's statements of reality, but it's getting weird. It's getting rough. So they would have digestive problems, they would have respiratory problems, they would have body pains and poor sleep. So there was definitely somatic manifestations of these problems. And you know, they always teach in specialty programs, if you're wise, that the best specialist is a really good generalist. So, you know, you can have specialty knowledge, but you always got to dial it back and look at the big picture, I think.
What jumped out at you, Natasha, from the talk? What stuck?
You know, I think it's really interesting to be able to offer a different perspective to our patients. Like, for example, when we look at the blood test, increase in ferritin levels that we learned about today can be a sign of inflammation and some sort of infection. It could be chronic, it could be acute. And we often see, clients in our practice come confused. They feel all these feelings. They feel, physiological feeling. They feel things physiologically. They don't feel good psychologically, and they're all confused. They're bouncing, from one doctor to the other, and yet, there is no solution. So I think, when we can look in one place from different perspectives, and then have consultants that specialize, in certain fields. Like certainly, um, I know just a little bit, but enough to kind of, look for professional advice. I think it can be very helpful to our clients, and then put them on a path of healing. And I always emphasize collaboration, and looking at a patient from different perspectives, and then helping them understand themselves and how they feel, physiologically, and then monitoring their progress.
So did you feel more comfortable, any more comfortable after the course in talking and managing and educating and guiding your clients through this process without knowing all the specific details? Was it helpful in that way? Did you feel more comfortable with that?
Yeah, certainly. Yeah. Like, I'm seeing more currently kids with developmental issues. So I feel like the dietary changes, some specific changes in supplementation can be very helpful. But there are some cases like of TBI. So that today's session was somewhat informative on that topic. And yeah, I mean, definitely, opening my mind and learning new things, and being able to provide, more answers, and be able to give referrals and direct my patients in the right direction. I feel like that's really empowering, both to the clinician and the patient. And as a result of that, you just, see more progress in the specialty that you are specialized in. Because as we said earlier, as you said, we could be doing neurofeedback all day long, but if the client has other issues that they are not addressing, that are really important for their homeostasis, then whatever we do is just going to have such a temporary effect, and we're not going to get to the root cause. So the objective is to get to the root cause, and to really, help the client improve their overall symptoms. Because when we talk about mental health disorders, they are not per se all in your head. They are oftentimes related to some physiological issues.
It's in their brain.
Yeah, but then they manifest through their behaviors. And actually, a lot of them feel a sense of relief, like, oh, it's like not all in my head. And so we validate, their feelings, we normalize them, and it's a big thing.
Yeah.
Yeah, I mean, and I think in the best case scenario, it's even more powerful than, validating. To me, that word has this sort of psychological connotation where it's like, yeah, that's okay, that's good, and I feel like more valuable than that is helping people identify sort of like what's going on underneath. And that may be, psychological in terms of like their past, but it can also be, physiological in terms of like how certain brain regions are dysregulated. And so, yeah, I think the beauty of like a great interpretation of the EEG is that kind of unburdening that comes from, yes, a validation, but also sort of like a opening the box and like elaboration kind of like what's happening underneath. And so, to me, this whole thing of like assessing the rest of the human body poses an interesting question, because, it's from an ethics and sort of scope of practice, perspective, I think it can be scary because like I'm not an MD, like not licensed to diagnose things, and like certainly in terms of neurofeedback, that's not my job either, nor my desire. And yet, like if you're trying to train a cryptopyroluria with, you know, beta at C3 training, neurofeedback training, right? Like if you're super adhering to your scope of practice by doing that and making really slow progress or no progress, like what is the, energy exchange of that, like leading someone on perhaps, and being afraid of the risk of asking the uncomfortable question, um, and or referring them to someone who knows how to ask that question. So I feel like there's this we have a soundtrack now.
Now we have music.
All of
Yeah.
a
It just
sudden
gets easier all day
it's just
long.
got more epic.
Well, you are absolutely right. My recent approach is like, when I have an interview with a client and their first session and assessment, I usually ask them to bring, all their labs, and so that, we can get a bigger picture. And also as a counselor, understand what my limitations are, how much I can help them. And I think it's important for a patient to get a perspective, where they are going, what they're dealing with. And if they were not aware, to clarify for them, and make it easier of a journey, but also to help them to be realistic, to connect the dots, and to connect to how they feel, and understand also that there is a lot that they can do for themselves, and that we are here just to support them on that journey the best we can. But they have a lot of power, and often, patients come to you exhausted, and they feel disempowered, they feel lost, and they feel like nothing ever worked for them. Medications didn't work. They had, so many doctors, and yet they're like, they don't feel like they're moving forward. So helping them move forward, and putting them on that right path, and also understanding our own limitations. Because if you don't really look at the bigger picture, and let's say I don't know how to read all the labs, but I will consult someone that does, and then, we'll bring in the client, and so I will have a clearer picture of how far I can go, and what I can do for the client, and then what are the other services that they need. Because I think triage is super important, and it's never just uh, focus only on one treatment only, but let's work all together. And I think that's lacking in the medical field. There is not enough collaborative work, and then patients are lost. And I think what was important today, what Michael emphasized, was that from my perspective, right, as a counselor, we can educate our clients, we can refer them out, we can motivate them to work on their health. So there is a lot that we can do, actually, um, to kind of bring the team of specialists that can help them together, and uh, help client understand that there is a lot that they can do for themselves because of all the epigenetic effects, and that these effects are reversible. So I think that in itself is really empowering, and people move forward, and come into the sessions like with more optimism, and hopefully, we'll have a better outcome when we work all together.
People are often relieved when they get these kinds of confirmations. When they've been doing poorly for months or years, and then with neurofeedback or with any therapy, and they suddenly discover that they've got mold through the roof, it's actually good news. And I tell them to have a party. I said, we found it. This is a reason why you haven't gotten better, and we have evidence as to why you haven't gotten better till now. It's not the only thing. We're not done, but man, once we find one and we make a hit, it's like playing Battleship.
Yeah, it's it's an investment in their future, and it's a lot of work for client as well. So I always want them to understand that there's quite a lot that they need to contribute.
Yeah,
Um,
a lot of work.
yeah, a lot of work. And it's amazing, when you get to the root core and to the root of their issues, and when you start to remove those layers of toxicity and behavioral issues, and you start to see slowly improvements. But if they have unresolved toxicity and we're just doing neurofeedback or neurostimulation, it could make them even worse potentially, right? You mentioned something regarding neurotoxicity, and then doing neurostimulation specifically that could, in some cases, actually worsen the symptoms of clients.
Oh yeah, if you can imagine, if you got poisoned either through whatever means of any kind, the last thing we would tell you to do is go run stairs and increase your metabolism and absorb and burn and utilize and metabolize more of that toxin. We would not say that. We would say, let's find a way to get it out of your body and detoxify it. So likewise, doing things like neurofeedback and photobiomodulation and even exercise, brain rehab, none of those things would be indicated if you've got a toxicity. And that's often surprising for people to discover. Wow, I've been making myself worse.
Yeah, when often when clients have low levels of energy, from a perspective of counseling or neurofeedback or neuromodulation, you don't have the substrate to work with. So you got to help them to increase their levels of energy naturally, which would be through improved nutrition, better sleep, and very moderate exercise in the beginning, proper hydration, which is such a basic thing, and yet people don't, hydrate themselves. And Michael talked earlier about hydration. So you can tell us a little bit more about hydration and how sodium and lack of sodium and minerals impacts the hydration and the performance of brain, and underperformance under such circumstances.
Oh, sure. Well, in a nutshell, we were just saying that when a person has poor electronegativity, their cells are not, they don't have a good baseline of staying electronegative from which they can fire an action potential. They usually have a problem of poor osmotic pressure, poor mineral retention, and poor amino acids. So we've got to give them positive and negatively charged minerals of a broad spectrum, trace minerals. We got to give them all the requisite amino acids, which are not normally present in foods. Even people that are eating skeletal muscle, they're not getting enough of the amino acids by ratio from organ meats and from cartilage and those kinds of things that they would get from skeletal muscle.
What do you mean skeletal muscle?
So steak, burgers,
You mean
chicken,
I
fish.
can't just eat steak?
Well, you could, but after a while, you might find a problem with deficiency of certain amino acid profiles that would give you difficulty with blood vessels and collagen formation, and you might have great muscles and great bulk of bodybuilding, but you might blow your tendons and blow your discs with things simple like people that step off a curb and they blow their Achilles tendon. You hear that all the time. People in the gym are super huge and then they do one curl and they blow their biceps tendon. They've got poor ratios of different structural proteins. So that's the way we would stabilize the membranes and have better neurofeedback, would be to make sure that they have not just water and not just electrolytes as sodium and potassium, but all of the 60 or 70 elements, the periodic table of the elements, all of the different electrolytes that aren't radioactive, and then of course the amino acids, as we talked about.
Yeah, and you linked some particular morphologies when it comes to the EEG, as for all of those who are doing EEGs, when we have low power, high beta.
Oh yeah,
or
low amplitude, high frequency.
Yes,
Yeah,
high
the ants on a
frequency.
page.
Yeah.
Exactly. Yeah, that's. I mean, Jay Gunkelman talks about it as a poor oxidative phosphorylation, poor energy production in the mitochondria, and that's a poor energy production. So the whole person is tired, not just their brain. So they're fatigued, they're weak, they're tired, they have no endurance. They can't produce hormones, they can't produce materials, they can't heal their injuries. So they have a low energy brain as well as a low energy body. And sometimes they don't have enough energy to generate digestion and sleep. So with low energy, paradoxically, you don't sleep well because you can't generate the right waves of sleep, which come from your brainstem. The ultimate like timekeeper of sleep is your pons and medulla and mesencephalon. Those sleep centers are there in the brainstem. And if they don't have a good enough ATP and good enough mitochondria, you'll sleep terribly, even though you're so tired.
And Nick, you have been working recently with trauma. Maybe some of what was shared in Mike's session pertains to some of your clients, like when it comes to neuroinflammation in depression and trauma. I think that's an interesting thing that we want to address, and it's important in a field of neurofeedback. And
Yeah, one of the populations is trauma, specifically, prison trauma and people who have either committed violent crimes or been, around them. And then there's also a population we're working with. This is with my colleague, Dr. Bob DeWars, who have been exposed to PCBs, the, coating that was used on a lot of different, as an electrical insulator that's toxic and lasts forever. And then he's also working with this population in Hawaii. So hopefully I'm going to be flying out there after the Suisun Summit, which is October 12th to the 14th. Yes. Yes, let's all go to Hawaii together. So in late October, we're hoping to collect EEGs and ERPs using the HBI methodology on this population that's been exposed to jet fuel. And a lot of people don't know this, but there was a pretty large exposure to toxic jet fuel and other industrial solvents on the Red Hill military base in Oahu, Hawaii. And I think the number of affected individuals is estimated somewhere between 10 and 40,000 people, and a lot of them very severely. And so, yeah, we're interested in looking at the EEG, and of course, in some of these people, we expect to find, slowing excessive delta and theta activity. But, as you sort of pointed to in your lecture, inflammation can manifest as a lot of different types of EEG presentations. And, depending on whether it's affecting the cortex more than it's affecting, some of the subcortical structures, you can see a general pattern of excitation or of, deactivation. And so I got to do my homework before end of October, but we're very curious to see sort of what those presentations are.
And do you know anything about how this population has been treated so far? Like, are they on certain medications? How is that going to impact the EEG?
Yeah, I mean, I think a lot of them are on some medications. It's been unfortunate. The government has allocated money for helping these individuals. We're going to have Lauren McKinney on the podcast in a couple of weeks to describe her own personal story dealing with the effects of this toxic exposure, and also being a real hub and coordinator for other people who are having issues with this. She's a social LMFT, I believe. But she's really coordinated a lot of different types of medical professionals. And so I think some of the population will have, some medications on board. I think a lot of them have not really been adequately treated because a lot of the symptoms are kind of like a diffuse array of dizziness, and it's a lot of and motor difficulties and vertigo.
Yeah, they need a neurological consult.
Yeah.
Yeah.
So they're experiencing diverse neurological symptoms, and I think having at best sort of mixed experiences in terms of like going the traditional medicine route and going to a hospital. And then, as far as I'm aware, there's a clinic that's been set up that's on a military base, which most of the general population aren't really taking advantage of. They're not really availing themselves to care there. I think a lot of people just don't know that it's there or don't want to go to a military facility. But that's what the government has invested the money in for helping take care of these individuals. So I'm really interested to see what's going on in the EEG and especially the ERPs. Um, and I think there's still a lot of need for better quality healthcare.
And what are their most prominent behavioral symptoms at present? And do you think that these people are headed towards cognitive disorders and some disability, or
I think
where
people
are
are
they at
having
on their?
possibly severe cognitive disorders and like lack of basic functioning, not being able to drive a car, feeling like they're going to drive off a cliff while they're driving their car, not being able to work, having migraines, having dizziness and nausea. I think there's weird cases of just death, or possible increase in, comorbidities with other diseases. So yeah, I haven't really done a deep dive on like the broader kind of like impact. There's a Facebook group for people who have been affected, which I am looking forward to joining. And part of the issue is like lack of documentation, and so that's one of the first things we're trying to help. In addition to getting high quality data on the sort of 10 individuals who are involved in this legal case, to also try to create a database of people who have been affected and some of their relevant health information. But I think there's a lot of different effects, and people have been affected to different amounts. So like the direct family members, people who were living on the base at the time, are the people who were affected the worst. Some of those people are still there, and I think the ones that could leave have left. But I think there's been a mix of exposures. So yeah, it will be interesting to follow, and hopefully, informative in terms of understanding the effects of certain toxic exposures on the EEG.
Well, we would hope that your findings and the assessments would inform some of the new treatments that these people could receive. And what would be your suggestions for their treatment?
Yeah, how do you detoxify jet fuel?
So detoxifying jet fuel and PCBs and these things are very difficult, but we use the same thing that we use in any case, which is we want to make sure that the patient isn't deficient of any nutrients. We want to make sure that they have, if anything, excess nutrients to be able to combat that. We want to use the phase 1 and phase 2 liver detox pathways, and that's mostly dependent on protein and magnesium, but we want to give herbs that will goose that, things like milk thistle and turmeric and other herbs and plant medicines that stimulate that, along with lots of protein. We wanted to use binders. We want to use things that have lots of surface area, which is essentially things like activated charcoal, diatomaceous earth. These are all taken orally or given rectally, and they just go into your body and collect toxins, and they really bind to everything. So you're binding indiscriminately to lots of stuff, including nutrients. So you got to take extra nutrients when you're doing this, a lot like a person who would be taking chelation therapy. You have to take extra minerals when you're taking chelation therapy because you're going to pee out healthy minerals as well as toxic metals. So even though you're not doing chelation, you still have to take extra minerals. You're going to be losing some nutrients. You're going to be turning over gut flora like crazy. You're going to be losing your bile like crazy because as normally we recycle our bile. And if you have all your bile being bound to all this binder that's going out of your body, you've got to make new bile at a pretty rapid pace. So you're going to really kick in your liver and your pancreas metabolism. You're going to have to feed it the components of bile, which is lecithin. You'll need to feed it L-taurine. You're going to need to feed it magnesium. You're going to need to feed it several different vitamins, but mostly those things. Maybe ox bile or some kind of a bile support from an organ meat that comes from liver, pancreas, and gallbladder and bile from these large animals. So yeah, you're trying to do as much as you can to mitigate the toxicity. I think there's going to be glutathione nebulized would be a great idea because nebulized glutathione goes through the lungs and it goes to every organ in the body, not just the liver. So if you're trying to detoxify a body that's been exposed to PCBs and jet fuel and other types of things, the only way to get it to the whole body is well, intravenous or nebulized glutathione, either into the blood or through the lungs, and that would be.
And where could people potentially get nebulizers?
Oh, you can buy a nebulizer online. Yep, they're portable without a prescription. You can buy a nebulizer for 30 or 40 bucks online. You can learn to use it yourself. You can take your own medicine that you would normally take orally and just mix it with a saline solution, put it in the nebulizer and breathe it. It's a great way to take glutathione and N-acetylcysteine. If you can't get N-acetylcysteine, which is very common, you just buy glutathione. There are many things you can nebulize. There's lots of choices. There is some danger that I should mention before we end that, which is if you detoxify too rapidly, you can really much hurt yourself. There are doctors that have written books about this whole subject of detoxification to make sure that you don't feel detox symptoms. If you feel detox symptoms, you're doing it too aggressively. You should feel just good. You shouldn't feel like I'm wearing this red badge of courage, which is what some people get into, where they're like, I'm taking detox agents, and they wear this as a badge on their chest, and they walk around feeling miserable and smelling badly, and just they don't do a very good job managing their detox, and so you don't want to do that. You don't want to detox so greatly that you're suffering. So it's very important to tune that and not overdo it.
Yeah, like knowing how to take your steps and how far you can go, and then people want to jump usually into intense treatments when they're not feeling well.
Yeah.
And just
more is not better.
fast. But truly, more is not better. And
Don't be a hero.
how do you see yourself, like in terms of, this seems like a great, simple and relatively inexpensive, affordable program that
It should take a while.
that takes
It's
a
slow.
while.
It's slow.
How would you pair that with some neurostimulation, or are you potentially thinking about maybe designing some kind of treatment program for this
It's
population?
a good question. I am. Definitely the first priority is in terms of like assessment and demonstrating that, from a legal perspective, there's still sort of battles going on, and that we want to use EEG and ERP to show that these people aren't just experiencing random symptoms, but that we know that their symptoms are correlated with each other, but also that their brain function is correlated with each other in terms of what's not necessarily working as well as it could be. But certainly, I mean, of course, my mind goes to like, okay, what are we going to do to help these people get better? And in some sense, I'm more conservative in terms of like, I'm a fan of all kinds of neuromodulation, old school and like neurostimulation, more, aggressive technologies, if you call them, although neurostimulation, I think, is still quite
Non-invasive.
non-invasive. But yeah, I definitely, I think about what Mike was just talking about in terms of like the metabolism of these things. We're always increasing blood flow, even with neurofeedback. If you're doing it right, you're probably increasing blood flow to certain areas.
We hope.
We hope.
Yeah,
we hope we're not shutting your brain off. And with neurostimulation, I think that effect can be greater. So I think, like anything, it's different, but it's also not, like we look at the brain and hopefully we're going to figure out some combination of supportive protocols in terms of possible supplements and like lifestyle dietary things that are going to help people detoxify. I think some of the EEG findings are going to be consistent and lend themselves to consistent kinds of protocols. If people are experiencing dizziness and like motor dysfunction, I mean, maybe some of the even classic like sensory motor strip kind of protocols, SMR, might be helpful for those people. I think that, I don't know how many, if there's any published literature on this particular type of jet fuel exposure and how neurofeedback can be helpful. So I'm hoping that we will get to the phase where that sort of conversation can happen, where legally people have sort of gotten the compensation that they deserve, which I think hasn't totally happened yet. And where there's the support on the grounds in Hawaii for high quality neuromodulation to be happening in a regular way that's accessible for these people. And I think the will is there, but the coordination hasn't yet happened.
Yeah, I think it's your assessment and ERP recordings and QEG recordings are going to be very important just to increase awareness of where these people are at, physiologically. And that, from my perspective, because I work with chronically mentally ill, they're headed towards disability. And that is very serious. What is the average age of this population, or it's kind of random?
I think the whole island has been affected to varying degrees. And I think the people who were most severely affected were people who were on the military base or very close to it. So, that's the filter for that. People who probably a higher proportion of, men in their 20s and 30s, but a lot of their partners and families also lived on the base as well. So I think it's a mix of ages. And I think it's a little bit the tip of the iceberg in terms of how many of these exposures has happened.
True. Yeah, I think that you're tapping into something really interesting, and that is that the traditional medical field is not addressing these issues in a way where people can get better, because the accent is not on a holistic healing and detox, and it's more, oh, let's see what your symptoms are, and then locking a client into different diagnoses. And I'm sure that some of the medical procedures, can be helpful. I don't want to be misunderstood. And a lot of testing that they have done so far certainly can provide very valuable data, for these clients to move forward, including your assessments.
Yeah.
But we can see, how what we are doing here and what this conference is about. Could potentially and hopefully lead to new treatments that can be utilized through insurances that people, the general population, can have access to, and that will potentially decrease the cost of their treatment and the damage to their lives, primarily. But there is also the cost that comes with disability, the days that they are not working, and the huge impact on their lives of their families. And considering that this is a large population, and we see that, all over the world, this kind of like toxic accidents from radioactive material spillage to, so many things going on. And I think you're doing something really important, and I'm hoping that your project will be successful.
I hope so. Yeah. Talking about it anyways. Haven't really done anything yet.
Well, you're talking and thinking about it and planning your steps. So
That's right.
but even just talking about this population, I think it's important to bring into awareness hazards like this and how they impact people's life. And these are innocent people that, they are just at the wrong place at the wrong time, and their whole life is turned upside down. And what I'm trying to emphasize is that there is no help, in a sense that there is something tangible, a type of treatment that they will get on that will resolve a lot of these issues. And the thing is that because of this severe kind of like epigenetic effect with the toxicity, we know that it's going to impact the gene transcription. And, Michael can tell us a little bit more about, how is that going to play out in these people's lives. But what is good is that we know that these effects are reversible, and the sooner they start some kind of treatment that is effective, the better outcomes, right?
Yeah. We could see not just reproductive problems in the offspring of these folks that reproduce during the time of their exposure, but lifelong activations of oncogenes and cancer genes and all kinds of things that would be turned on in a bad way by these toxins. And the longer they're exposed to them, the more those genes get a chance to be expressed. So I would expect not only reproductive and generational problems, but I would expect the the living people's entire lifespan, even if they live and survive for decades, to be continuing problems and new problems developing unless we can even if we can very aggressively go after that.
And potentially higher rates of cancer, because we
Oh,
know that
yeah.
toxicity and radioactive materials changes gene transcription, and then all these oncogenes are expressed, and that leads, down the line to an increase in cancer. And it's sad because there are ways to prevent it. So I'm hoping that you will, get
I'm
to
going to
them.
save them all.
I think there will
He's
be
our hope.
yeah, I think there will be a
I
gambit that'll be
hope.
played that is unfortunate, which is they will probably start to pull out illnesses and say, well, that's a genetic illness, that's a familial illness, that person had that in their families. And they won't acknowledge that the biochemical individuality of the person means that whatever they're carrying in the deck of cards that they were dealt at birth will be expressed. So any bad genes, if you will, that they inherited will be expressed because of this toxic exposure. And it is fully blamable, if you will, fully, you can pin this on the culpability on the toxic exposure. And they're going to try to play this gambit where they say, well, that's a familial problem. Not everyone had that, only you had that, or only a few people had that. And that's still a mechanism that they're responsible for. And they covered it up, and they were incompetent, and they hid it, and they kicked the can down the road. This is really a problem on many levels, and I hope some really good lawyers get involved in this.
Yeah, I hope so too. And that's why I'm hoping that the first stage, which is assessment and kind of like bringing into awareness and collecting this data, is like the first step to help these people. And I believe there is hope for them. And yeah, it's really important to know how toxicity impacts the genes and the oncogenes, and that we cannot ignore it, and that there are ways to treat that and to reverse things before they, get worse over time.
Absolutely.
So what's next?
You've opened a can of worms, Nikki.
Yeah, no, we
What are we
opened
gonna do
so
now?
many topics. Yes. Well, we are hoping that, other sessions and presentations that we are going to attend are going to be as informative, and that we can open up so many different topics and, get informed or on new research. Yeah, and you said what's new. I think that it's for us who are in the field, it's important to increase awareness among professionals. Even if you're a clinician, do the best you can to stay on top of the new research so that your practice is informed. Yeah, do case studies. You can quantify case studies over time, collect data, and this is the only way we can move the field forward and learn from each other, and share the knowledge.
I'm going to make a prediction. I think that we're going to find that independent component analysis will help us pull out some toxic nidus somewhere at some point, where we can find a component once in a while that may be very transient, that happens in certain people but not everybody, that we can pin on some particular toxic exposure or metabolic phenomenon. I think we'll start seeing that in ICA analysis as we get better at it.
Would you say then, using that logic, that there are certain parts of the brain that would be more prone to lighting up and showing up on independent component analysis as parts that will they'll have more receptors for that particular toxin, or for
Well,
inflammatory?
oh yeah, there's differences in the responses of different parts of the brain to toxins, and we talked about specifically the basal ganglia. And while we can't see the basal ganglia directly on EEG, we can see the effects of it. And so the basal ganglia drives the thalamus to drive the cortex. So these different networks that activate may be puppets that are on strings attached to the basal ganglia that's poisoned. And so if a poisoned basal ganglia sets up a component of a component analysis that's toxic, we might find that that's an echo or an expression of a toxic exposure. It may be transient, short-lasting. It may be part of a curve that's at the early phase of exposure, or the middle phase, or the late phase. It may be dose-dependent. I don't know. It may be a signature of two different toxins when they're combined, like, atrazine and jet fuel. Who knows? I can't predict that. But what I think I'm trying to predict is that there will be some signatures that are extracted from the ICA that are metabolic. And I think we'll find those in the next few years here.
How dare you suggest that ICA might be useful?
I dare it. I dare it.
Exciting.
We had a presentation today about ICA, which I was unable to attend, from Tom Kalura, but that
It was great.
Oh, he was great.
I was there. It was great.
Very cool. That's probably a conversation for another.
Yeah.
It's a whole other episode. Sure.
Yes, absolutely. Yeah, independent component analysis and connectivity, and yeah, it was really well done. And yeah, I want to also add that Nick Dogris is also, moving his software forward when it comes to independent component analysis and
That's right.
incorporating connectivity. And so we'll see, how all that goes. It's kind of controversial, and we have some sort of a division.
Why did someone say something bad about it?
Well, I don't know. I don't know, but yeah, I mean, generally speaking, and I think that Tom Kalura helped clarify that that if we take out too much data, that the phase will be, broken, and that will affect the way we see connectivity. So the message is like, don't take out much data. It will decrease the power, the overall power, and you won't really see what you're supposed to see.
Right.
But that's what was shared today, and I think earlier in some of the conferences, and these were some concerns when it comes to independent component analysis. But I think if only eye blinks are taken out and we preserve most of the data, and we always we can always compare with other tests and results and neuroimaging methods. So then we can get a clearer picture and see, if the independent component analysis is off, or it's, aligning with other findings.
Yeah, and my experience has been that, MRI, SPECT scans, these other technologies, CT, PET, they can be very beautiful and very cool and sometimes very helpful, but that the EEG often tells more.
It does, and I think it will be good to look at and compare, the results, and then do the, EEG, and then you do fMRI and all this other, do PET, whatever else, and then look at these different imaging results.
Yeah.
And compare the data and see where we are all at.
Yeah.
So I'm kind of interested in looking further into that possible.
And maybe that's something we can do with these 10 individuals in Hawaii. I think they have some other neuroimaging data that could possibly cross-correlate.
Yeah, that came to my mind because I think with toxicity, we can look at the metabolism and changes in metabolism, and use functional MRI, and then look at quantitative EEG, do independent component analysis, and compare all the images that we are getting, and have a better understanding of.
Yeah, and from a lab perspective, we don't want to just test for the toxins that we're looking for. We want to test for all kinds of disorders of metabolism that are downstream of those toxins, like mitochondrial problems and endocrine problems and blood problems, and everything that you could or should measure that would be reflected, that would be echoed from the chemical exposure, not just keep a narrow band of looking at just the chemical exposure.
Right, because the patient, depending on their genotype, they could develop all kinds of different disorders. That's kind of like what I'm understanding. And we come back to another interesting topic, which is individualized treatment, and being able to understand, what are the weaknesses of this particular individual, and where, is the toxicity going to take them. Somebody could develop a liver cancer, another one could develop a brain tumor, or it's never going to be probably the same type of reaction. I'm curious about, the metabolism of the brain, in particular, how it looks when people are exposed to different toxins. I don't know if there were any studies done on the impact on the metabolism of the brain, and exposure to different types of toxins. As you said, when you look at the labs, you wouldn't just focus on
Oh
the
yeah.
toxins, but on the metabolism and what the toxicity does to metabolism. So, do you
Well,
have any?
I don't have them at the tip of my tongue, but there are a number of toxicology studies that look at every organ, from the liver to the brain to the kidneys to skin cells to hair cells. I mean, everything. But the thing we're missing is the EEG studies. And so I think if we could go back and reproduce some of those studies and add a layer of EEG on top of them, that'd be really cool to see the differences. And ERP as well. It'd be really good to see that. There's a lot known about toxicology, but there's also not a lot known because they tend to study one agent at a time and not two agents or three agents.
Yeah, that was my original question. Like, do we have any information on how different agents impact the brain and what would be the difference?
Very little. And the industry doesn't want those. They don't want to have you look at two toxins in the same person. They don't want to look at that because it would confound a lot of the results that they already have. For example, what if a person is already exposed to one chemical ubiquitously and it's considered okay, but then they add the second chemical on top of it? If they're only studying the second chemical and they're not looking at the original first chemical, they don't realize how toxic those patients might be because of the additive effects and the cumulative effects of those two things. So it's not in the interest of industry to look at that. So they're not going to fund it, and it's going to be suppressed.
I think that you are opening up another long topic because toxicity, is becoming a big concern for all of us, and we are all exposed to higher levels of toxicity. And all over the world, we see a huge impact on the development of kids and a cognitive decline. I mean, in terms of cognitive performance, that each new generation of kids, when they start school, they score lower on testing.
Oh, and not to mention sperm counts and testosterone levels. It's the fertility is suffering. Absolutely.
So I think that the research when it comes to toxicity has a huge value in terms of recognizing some of the early biomarkers, even when it comes to smaller, amounts of toxins
Yes.
that we are ingesting, and then being able to address that and to recognize that just by looking, at the EEG. And another thing that Nikki mentioned was, the efficacy and the cost of EEG. EEG is
It's cheap.
cheap.
It's real cheap.
Cheap.
Yeah.
And
I think my hope is that, we'll start to appreciate EEG more outside of just the scope of doing neurofeedback, but from the perspective of having a kind of objective measure for how the brain is evolving over time. Like when you think of like what we spend on healthcare, what we spend on education for kids, parents want their children to be developing well. And, they might go through some cognitive testing, which can be helpful. I did that when I was a kid. But yeah, this idea that we have more objective measures in brain development for how our world is impacting, and it can be different toxic exposures, medications, all sorts of stuff. We're keeping it safe for YouTube, but
Yeah.
but the value of the EEG is, I think, still so just balkanized. It's like it's a lost art, and I hope that we can make a difference.
Yeah, that's why research is important, and then presenting data and validating that data, and then moving forward and doing more research. Because with the quantitative EEG and using the reverse formula, we can really look at the deeper regions of the brain, and it's comparable to MRI, much cheaper, easier to do, quicker. So it's cost effective, and we can gather a lot of valuable data that can be useful to all medical professionals in treatment of different disorders, right?
Yeah. Yeah. I think even teachers would like to see it.
Yeah.
Yeah,
Even teachers.
absolutely. Yeah.
Folks, any final thoughts?
Gosh, Nick, thank you so much for putting this together right here at the ISNR conference.
Yes, you're welcome for all of the background noise. We had an accompaniment. I think that was a live performance.
I think so.
I don't think that couldn't have been recorded music. So, Michael Pierce, where can people find you?
Oh, well, I'm on The Human Condition is our YouTube channel, and the website is humanconditionlab.com. And there is you can attend ISNR conferences. You can watch the replays of the ISNR conference, and I'll be at Suisun in the Suisun conference in October.
Suisun Summit, October 12th to 14th.
That's right.
You can Google Suisun Summit, Gray Matters Neurofeedback.
I hope to see some of you at Low Carb Denver in February, and I hope to see some of you at other seminars, and certainly even functional neurology seminars and neurofeedback seminars, and yeah.
And Natasha, where can people find you?
Well, I'm located in Miami. The name of my company is Miami Brain Health Center, and it's like my new baby. So it's in development. And yeah, I'll be
Coming
around.
soon to the interwebs.
Yes. So yeah, I'll be attending all the conferences that Mike mentioned, and looking forward to seeing everyone at Suisun. I'm not pronouncing Suisun.
Yeah, and there's no
having
pronunciation.
trouble pronouncing this.
Yeah, I don't know how
Even
to
when you
pronounce
get it
it
right,
either.
it feels wrong.
Yeah. Yeah. So hope to see everyone there.
Yeah, everyone come to the party.
Please.
Please
Thank you
join
for
us.
watching. This is EEG Worlds. Peace.
Thank you, Nikki.
Thank you.
For hosting.
Thanks for coming.
You're welcome.
How fun.
This was fun.
That was neat.